Good morning. I'm John Woodrich, CEO of Bryan Medical Center. Thank you for attending our briefing today on January the 14th. I thought I would first, again, thank everybody for continuing to mask, social distancing, and washing your hands. You've made a tremendous impact on what we were all fearing after the holidays, and your diligence has really paid off. So I'm going to share with you our midnight census is 539. We have 79 COVID patients in-house. 67 of those are positive, 10 are still recovering, and 2 are what we call clinically positive but laboratory negative. We've seen that number stay pretty steady over the last several weeks, so that's really a good sign that we're making some good progress on dealing with this pandemic. From a levels of care, we have 12 of those individuals in our intensive care unit, 26 in our PCU unit, and 41 in our general care unit. 7 of those individuals are on ventilators. By county, 51 of those individuals are from Lancaster County and 28 from outside of our county. I did want to share with you that we continue to work with the vaccine and administering it as quick as we receive it. We have now vaccinated just shy of 3,900 of our employees, and of that 3,900, more than 2,600 have received their second dose of the vaccine. And then we have administered to providers, which are doctors and advanced practice providers, and some of their clinical staff in private practices throughout Lincoln. 1,139 have received their first dose, and just shy of 500 have received their second dose. So we're over 8,100 individuals have, or 81 doses have been given out to individuals. I did want to share a little bit, you've been hearing a lot in the press about the vaccine being administered or sent out, and is it being administered as quickly, and are people holding vaccine? I thought it would be good to just go through a little bit about the process. So when we receive, and let's just pick a number, 1,000 doses of a vaccine, then what we do is we contact people and we schedule them to come in and receive that vaccine. And then you look at the end of the day and say, of the people that we notified, how many of those have signed up, and then you have some doses that could still be left over for the next group of individuals that we vaccinate. So when you hear that, across the country they're not administering as quickly, I think the right question to ask is how many doses have been given out throughout the area, then how many are scheduled, and then what's truly left. Because if you look at just what's on the shelf, I could have 1,000 doses of something, but in the next 3 days I have 800 people scheduled to receive that vaccine. So I think it's important that people keep that in perspective when they hear those numbers. I do want to just make another shout out to our Lancaster County Health Department. I think they're doing an excellent job keeping all of us informed, as well as the hospitals and the collaboration that's occurring as we continue to go through these different stages and address getting the vaccine into individuals. I believe in relationship to COVID, no, some of the same things that you have heard they had been doing in the past, they're still doing as we receive COVID patients. Again, I can't emphasize this enough. I think people are doing a pretty good job in continuing to social distance and that we're not seeing these outbreaks. And by able to control this, it just helps us as healthcare providers continue to take care of not just our COVID patients, but all of these other individuals that still continue to need care. We did open up last Monday all of our elective surgeries again, and we've seen that within our numbers for our hospital census. But just think about it, there's been a number of people that have been waiting a long time to get some of their surgeries completed. I think the numbers are going to be pretty large as people hear about how many people over the age of 65 reside in our community. And that's why I believe you hear a lot that, when you open something like that up, you want to assure that there's enough vaccine coming in the pipeline, because you don't want to vaccinate a number of individuals and then as the others come forward you say, well, I'm out of the vaccine, you have to wait. I think that creates more anxiety than we really need at this point in time. But the logistics behind this is complicated, but there's a lot of great people working on it. We're just trying to do the best that we can to get this in people as quickly as we can. I think the health department and the mayor would probably be announcing something like that. So we've been continuing to go down tiers. I know the other group that we're still focused on is trying to take care of the dentists, chiropractors, some of those individuals and their office staff that reside in those type of settings, as well as hospice workers. So there is quite a list of businesses and individuals that provide care that I'm not sure the general public always thinks about. So we're wanting to take care of those folks as well, and then start to address the elderly population and individuals that are compromised in some fashion. That is a question that has not been fully vetted yet, and the purpose for that being is you have to be certified to be a center that can vaccinate. And even Bryan, at the end of a day when we have people scheduled, if for some reason people don't show up or we had to draw out of a vial, we don't want to waste anything. So then we start going and calling up on the floors to see who might be scheduled the next day so that we're not wasting vaccine. So if you administer this to a large number of locations, there's going to be a lot of waste of the vaccine. And I think we're trying to be good stewards of a precious resource as we continue to move forward. So I could imagine that you're going to see specific centers set up, but I don't envision that it's just going to be at every clinic that's out there today. They seem to be adequate right now as we take care of patients. From a supply perspective, I think the supply chain has gotten a lot better. We're in good shape from a PPE perspective, but we're always hesitant about continuing to let people understand that as long as we can keep this under control, our burn rate of those supplies we're able to withstand right now. But if you have another major outbreak, you can go through it pretty quickly, but we're in good shape right now.